Welcome to 5 Mark Short Note Series. Today we will discuss about biophysical profile (BPP). So what is a BPP? Biophysical profile is a composite fetal assessment method to evaluate fetal oxygenation and detect fetal hypoxia by combining ultrasound-based parameters and fetal heart rate reactivity. It reflects acute and chronic fetal hypoxemia, effects on central nervous system, and regulation of fetal activities. Indications for BPP: post-dated pregnancy, decreased fetal movements, gestational hypertension, diabetes mellitus in pregnancy, intrauterine growth retardation, RH isoimmunization, oligohydramnios or polyhydramnios, high-risk pregnancies requiring fetal surveillance. So what is the Manning score components? Actually, BPP consists of 5 parameters: non-stress test, fetal breathing movements, gross fetal body movements, fetal tones, amniotic fluid volume. Each variable is scored as a 2, which is considered as normal, and 0 is considered as abnormal. So there is no scoring of 1. So the result will be always 0, 2, 4, 6, 8, and 10, only in even numbers. No intermediate score is present with a maximum score of 10 and a minimum score of 0. The neurophysiology behind the parameters. Tone. It represents the integrity of motor nuclei and long tracts. Last to be lost in hypoxia, which is a chronic indicator. Gross movements reflects the cortical and subcortical integrity lost after tone but before breathing. Breathing movements. It is controlled by pontine respiratory centers, highly oxygen dependent and earliest to be suppressed. Non-stress test reflects autonomic function, SNS and the PNS, and its loss indicates acute compromise. Amniotic fluid volume. It reflects chronic placental insufficiency via decreased fetal urine output. In case of non-stress test, the reactive will get 2 scores, and if it is non-reactive, that is abnormal. Fetal breathing movement, greater than 1 episode of fetal breathing movement lasting greater than 30 seconds in 30 minutes. If it is absent or less than 30 seconds, it is considered as 0. Greater than or equal to 3 distinct discrete movements in 30 minutes, or if it is less than 3 movements. Fetal tone. Greater than 1 episode of extension with return to flexion will be considered as normal, and if it is absent or slow extension, it is considered as abnormal. In case of amniotic fluid, single deepest pocket greater than or equal to 2 centimeter, or amniotic fluid greater than or equal to 5 centimeter. So the SDP less than 2 centimeter or AFI less than 5 centimeter is considered as abnormal. Interpretation. 8 to 10 is considered as normal and reassuring, which requires just a routine follow. 6 is considered as equivocal. Repeat BPP within for 24 hours and consider doing a Doppler. 4 is considered as abnormal and further evaluation and consider delivery depending on the gestational age. If it is 0 to 2, strong suspicion of fetal hypoxia, immediate obstetric action and consider delivery. Fetal tone. It is earliest developed in the motor nuclei and least sensitive to hypoxia, and it is represented through tone. Gross movements, cortex and subcortical region. It is moderately sensitive to hypoxia, and it is identified through movements. Breathing movements, pontine respiratory centers, which is highly sensitive. NST, it is autonomic nervous system, which is also highly sensitive to hypoxia. Amniotic fluid, it is a long-term hypoxic indicator and reflects a chronic uteroplacental function. Modified BPP, it consists of NST and amniotic fluid index. In case of amniotic fluid index, if it is greater than 5 centimeter, considered as normal. Less than 5 centimeter, it is considered as oligohydramnios and it is abnormal. Interpretation. So the normal modified BPP is reactive NST plus adequate AFI. Advantages and limitations. Considering the advantages, assess both acute and chronic fetal hypoxia, which is non-invasive and ultrasound based. The limitation include it is time consuming as it takes 30 minutes per patient. There will be observer variability and decreased fetal activity during sleep cycles that may mimic abnormality. So to summarize, biophysical profile is based on Manning scoring system and is a fetal surveillance tool. It assesses fetal oxygenation by combining 5 parameters: non-stress test, fetal breathing movements, gross body movements, fetal tone, and amniotic fluid volume. Each variable is scored as 2 in case of normal and 0 for abnormal with a maximum score of 10. 8 to 10 is reassuring, 6 is equivocal, and less than 4 suggests a fetal compromise. The test reflects both acute phase, that is acute hypoxia, where there is loss of NST and breathing movements, and chronic hypoxia, where there is reduced movements, tone, and oligohydramnias. A modified version uses only NST and AFI. I hope you have learned during this short presentation. Thank you for watching.